A novel therapy developed at the University of Alabama at Birmingham ameliorates obesity and type 2 diabetes in mice fed a high-fat diet. The therapy acts through sustained release of nitric oxide, a gaseous signaling chemical whose most important function in the body is relaxing the inner muscles of blood vessels. The strategy of reducing body weight by the local delivery of nitric oxide may be a novel, efficient and safe way to prevent and treat multiple metabolic diseases. This study, published in the journal ACS Applied Materials Interfaces, used an ingenious self-assembling, nanomatrix gel capable of R. The gel was developed by UAB researchers Ho Wook Jun, Ph.D., and Brigitte Brott, M.D., and it is licensed through the UAB Harbert Institute for Innovation and Entrepreneurship by their UAB spin-off company, Endomimetics LLC. The gel was injected subcutaneously into 8-week-old mice every 2 weeks for 12 weeks. Gel-injected mice and control mice were fed a high-fat diet, known to induce obesity and insulin resistance. At the end of 12 weeks, the nitric oxide mice had gained 17% less body weight, compared to controls, and that weight difference was due mainly to decreased fat, not lean mass or water content. The researchers saw increased phosphorylation of the enzyme hormone-sensitive lipase and a reduction in the size of fat cells in epididymal white adipose tissue, or EWAT. Nitric oxide is known to increase mitochondrial biogenesis, a mechanism for the conversion of white adipocytes to beige adipocytes. Brown adipose tissue, or brown fat, produces heat to maintain body temperature in cold conditions. The fat cells in brown adipose tissue and in inguinal adipose tissue from the nitric oxide mice were also smaller than cells from controls. The mice that received the nitric oxide gel also had improved cerebral blood flow, and they showed significantly improved spatial learning ability, as measured by the Morris-Water maze test. It is unknown whether those changes were a direct effect of nitric oxide or were mediated through the neuroprotective effects of adipocyte beaging. Co-authors with Kim, Jun and Brott in the study, subcutaneous administration of nitric oxide releasing nanomatrix gel ameliorates obesity and insulin resistance in high-fat diet-induced obese mice, are Guang Ren and Sushant Bhatnagar, UAB Department of Medicine, Division of Endocrinology, Diabetes. At UAB, Kim is an associate professor in the UAB Department of Medicine, Division of Endocrinology, Diabetes and Metabolism, and she is a scientist in the UAB Comprehensive Diabetes Center. Support came from UAB and from National Institutes of Health grants DKO 79626, HL 128695, HL 163802, AGO 58078, DK 9597503. DK 12068401, DK 109789 and NSO 47466. Retrieved April 29, 2022 from ift.tt/UCIDO5 University of Alabama at Birmingham. https://ift. UCDO5 accessed April 29, 2022. Thanks for watching. Please subscribe my channel for more videos.